So, when you think about hip problems or someone needing a hip replacement, what's the first thing that pops into your head? Yeah, for most of us, it's probably our grandparents, right? Someone who's lived a long, full life. Well, today, we're going to talk about a condition that completely flips that idea on its head. What if I told you that one of the biggest reasons for total hip replacements actually affects people who are smack in the middle of their prime? It's a really serious condition. It often hits without any warning, and it's got nothing to do with just getting old.
All right, let's just let this sink in. This number you're looking at, 33 to 38, that's the average age range for patients getting treated for this thing. We're talking about people in their 30s, building careers, raising young kids. This is proof that this isn't about simple wear and tear. Nope, this is something else entirely.
That's exactly right. We're talking about a young person's disease. It's called avascular necrosis, and it's a huge reason why so many young and middle-aged adults find themselves needing a total hip replacement. So what on earth is it?
Avascular necrosis, or AVN for short, it's about as serious as it sounds. The name literally breaks down to bone death without blood. It's a process where a part of your bone, and it most often happens at the very top of your thigh bone, the femoral head, loses its blood supply. And without that blood bringing in nutrients, the bone tissue just dies. It becomes weak and brittle, basically crumbling from the inside out.
Okay, so this is the big question, right? How does that lifeline, that critical blood supply, get cut off in the first place? If the bone is dying because it's starved of blood, you gotta ask, what's stopping the flow?
Here's a great way to picture it. Just imagine the head of your femur is like a bustling, healthy island. Now, the blood vessels, they're the only bridges that connect this island to the mainland. They bring in all the food, water, and supplies, everything it needs to survive. AVN is what happens when those bridges get knocked down.
And this flowchart here, it does a fantastic job of showing us exactly how those bridges can get destroyed. You can see there are really two main roads that lead to this disaster. On one side, you've got traumatic causes, a direct physical injury. And on the other side, you have non-traumatic causes, which are often a lot sneakier.
So let's look at the usual suspects. The traumatic causes are pretty straightforward. A really bad injury, like dislocating your hip or a major fracture, can literally just tear those blood vessels apart. But it's that non-traumatic list that catches so many people by surprise. Taking high-dose steroids, for instance, the thinking is that it messes with how your body breaks down fats. Those fats can then build up and clog the tiny little blood vessels that feed the bone. And something similar is thought to happen with heavy alcohol use. It causes the same kind of fatty buildup, choking off that vital blood flow.
Okay, so if all of this damage is happening deep inside the bone, and it's often totally silent at first, how in the world do doctors actually see it? Finding AVN early is everything, and it's kind of like looking for an invisible enemy.
And this right here, this shows you why it's so tough to catch. On the left is a standard X-ray. In the early stages of AVN, that X-ray can look perfectly normal. The bone is literally starting to die, but the damage is on such a tiny scale that a normal X-ray just can't pick it up yet.
And that is where the MRI becomes an absolute game changer. It's so sensitive that it can see the very first signs of trouble, like swelling in the bone marrow because of the lack of blood flow. With about 99% accuracy, the MRI is the undisputed gold standard. It lets doctors see what's really happening long before an X-ray would show anything at all.
Now this is when things get really serious. There's a critical warning sign that doctors are looking for, and it's called the crescent sign. It's basically a tiny little fracture that shows up right under the surface of the bone. What it's telling you is that the whole structure is failing and it's about to collapse under its own weight. Spotting this sign is the moment of truth.
And that discovery kicks off a frantic race against time. Once that crescent sign appears, it's all about trying to do something, anything, to stop the entire femoral head from caving in.
And make no mistake, the stakes in this race are incredibly high. This statistic says it all. If you don't treat it, up to 80% of hips with AVN will go on to collapse. That's why catching it early and jumping into action is so important.
Now, if you do catch it early enough, before a major collapse, the #1 goal is to try and save the natural joint. Doctors can do things like drill tiny holes into the bone to relieve pressure and hopefully get blood flowing again, or they can do bone grafting, like you see here. The whole idea is to give that dying bone some structural support and create a kind of scaffold for new, healthy bone to grow back, saving the patient's own hip.
But once the top of that bone has flattened out or collapsed like you can see on the left, those options for saving the joint are pretty much off the table. At that point, the damage is done, and the only real definitive solution is a total hip replacement, where they remove the damaged bone and replace it with a new, artificial joint.
So, saving the joint or replacing it, those are the main strategies today. But the future of treatment is looking at something even more incredible: regeneration.
And this is where the science gets really exciting. Researchers are looking at brand new ideas that go way beyond just patching things up. They're trying to use a patient's own stem cells to bring that dead area of bone back to life. They're injecting powerful proteins that act like a supercharger for healing. And they're even using these advanced metal rods that new bone can actually grow right into.
So all of this leads to one last really amazing question. Right now, the whole game is about trying to win that race against collapse. But what if we could change the rules? If all this regenerative science keeps moving forward, could we one day get to a point where we don't just stop the damage, but actually reverse it? Rebuild that dead bone before that urgent, desperate race even has to start?